Hi, everyone. Welcome to another episode of the NPA podcast. We are so excited that you're here. And my name is Dr. Efrat LaMandre, and everyone calls me E, and I'm the president of the NPA board. Super excited to be here. And today we have an amazing guest. Her name is Dr. Mary Koslap-Petraco. Before I bring her on, let me tell you a few things. I'm going to be looking down because I have to read it because her bio is pretty impressive, but I didn't memorize it. So here we go. Dr. Mary Koslap-Petraco is a clinical assistant professor at Stony Brook University School of Nursing in Stony Brook, New York, and a PCP in her own private practice after working for Suffolk County Department of Health Services for 30 years, where she used her experience as a public health nurse to make system-level changes. You go, girl. While on the staff at SCDHS, Dr. Koslap-Petraco managed the immunization and lead programs and provided education to staff and the public on various communicable diseases and assisted in the management of communicable diseases. She's the member of the ad hoc advisory board of the New York State Get Smart Safe Use of Antibiotics campaign, the Centers for Disease Control and Prevention Ad Hoc Nurse Advisory Group, a nurse consultant for the Immunization Action Coalition, and chair of the scientific advisory board of Vaccinate Your Family, the next generation of every child by 2. Dr. Koslap-Petraco speaks on immunizations and infectious diseases nationally and internationally and has authored numerous articles and written chapters in 4 textbooks. She's a fellow of the American Association of Nurse Practitioners. I am super excited to talk to her. Welcome, Dr. Mary Koslap-Petraco.
Well, I'm thrilled to be here with you today, E.
Likewise. So I just have a few questions. I want all our audience to get to know you and get to know how awesome NPs are. So if you could just tell us a little bit about your healthcare journey, that would be amazing.
Well, I started out my journey as a diploma graduate. I graduated from the Bellevue School of Nursing, which was the first nursing program based on the Nightingale Plan in the United States. And it was a journey from there. And I wound up at one point working for the health department because I just got tired of the nonsense in the hospital. And while I was working at the health department, I just felt that the nurse practitioner movement was really just getting started. And I felt that this was the place for me to go because I was the triage nurse in the health center, and I was sending these children back for the physicians to see. And I said, I could do this and I can teach them better than the physician too. So it's time to go back to school. So that's really how I got started as an NP.
So how did you get involved in the NPA?
Well, we have always had an extremely active chapter here on Long Island, the Nurse Practitioner Association of Long Island, better known as NPA-LI. And there were many of our instructors were involved in the organization. And on graduation day, as we were walking out of the ceremony, the president, that president was standing by the door with a big basket with pens and little cards in it, telling us how to join. And she said, you can't do this in a vacuum. You have to get involved. Come join us at the NPA. And, she just very quickly went over the advantages of joining right as I graduated, which meant that I still got the student rate. So I said, and as I said, I had met several people before. I said, this is something I'd like to get involved with. Besides the fact, working for the health department, I learned that the political process was very important, and you can't get along without it.
So you mentioned you've been on the legislative process for some time. So what are some of the changes you've seen in the NP world?
Well, I was mentored by some really excellent people, and I am the current legislative issues chair for the Nurse Practitioner Association of Long Island. And one of the big things I have seen is when the Nurse Practitioner Modernization Act, the original one, was passed almost 6 years ago. That gave us the ability for anyone with at least 3,600 hours of clinical practice to just kind of like write ourselves a document that said we were going to collaborate. And I didn't have to have a written practice agreement anymore. I didn't have to have someone auditing my charts. Because quite honestly, if I have to do that now, I got to give my practice up because I can't afford to hire somebody to look at 4 charts a year, which is ridiculous.
Sure. So I have a question for you before we go, because I don't want to take up too much of your time. And this is a question that you probably encounter all the time, but what advice would you give to a recent graduate of an MP program?
Join the NPA. I sound like a broken record, But there are strength in numbers. I'm a pediatric person. A lot of the legislation that we get passed doesn't generally apply to me personally, but as a group, we need to work together. The representative for nurse practitioners in New York State, we are well respected. Um, Groups come to us looking for advice. I have legislators. I've heard legislators on more than one occasion say that they call the NPA when they're looking for an expert. And you can't do this in a vacuum. I'm saying it all over again. We could be legislated out of existence with a stroke of a pen. So that's why we all need to get together, join the NPA, and reap the benefits of belonging to this incredible organization. I mean, most of what I talked about was legislative things, but there's other things. We have some of the best CE here, and a lot of it is free. A lot of it is like cheap as anything. It's $25. You can get it online. You can get it. At a conference. Just the collegiality that we have is just so important.
Sure. I love that. I couldn't agree more. I mean, I tell all my students all the time, join the NPA. I agree so much. So I really just want to thank you for your time, Dr. Mary, and I wish you well. And I'm looking forward to all the great legislative things you're going to do in Long Island and in New York. Look forward to working together and collaborating together. Thank you so much for your time.
There's one thing I did forget to tell you, though.
Yes,
one thing that I almost forgot. You never know where this is going to take you. Because you can see plaques on the back of my walls there. Well, that one right underneath the map there, that's the Nurse Practitioner of New York State Award that I won from the NPA several years ago. Never in my wildest dreams did I think when I graduated I was going to be at that point. But working together with all our colleagues, the NPA is really very quick to recognize the efforts of its members to work hard for different things that are important to us as nurse practitioners.
I am so glad that you mentioned that because it is a very prestigious award, and I'm glad that you mentioned it because for those of you who see those emails that come out about NP of the year, it's a big deal, and I'm glad to be speaking to our recipients of the award. So thank you for bringing that to our attention. To those of you listening, you might be next. If you want a plaque on the wall, the very first thing you have to do is join. So
yes, and we even have a student award. We have a student nurse practitioner of the year.
That's right.
I won that too when I went to graduate school.
That's right. Amazing. Thank you so much for your sage advice, and I look forward to seeing you at our next event.
I'll be there.
Okay, great. Bye to everyone. See you next week.
Bye. Thank you.